A 3-year study into the transformation of community mental health care in Norfolk and Waveney has now concluded, with Healthwatch Norfolk providing a number of recommendations for improvements. We were asked to look at how well the Community Mental Health Transformation Steering Group is delivering on its plan to change community-based mental health services in the area. The group is made up of people from local health and social care providers, service users, staff who work in mental health services, and the voluntary, community and social enterprise sector. In the first 2 years of the project, we spoke with the steering group about their plans, engaged with staff from the mental health workforce and wider stakeholders, and spoke to adults with a serious mental illness and their carers, so that we could understand how their experiences of care were changing over the course of the study. In the third and final year of this project, we wanted to focus on those adults with serious mental illness who have used community-based mental health services within the past 5 years to determine whether they have seen any positive change. So what did they tell us? Whilst participants noted that there have been some improvements, such as support through GP surgeries, the perinatal service, the introduction of wellbeing hubs, and a more general understanding of the different forms of mental illness, most people were negative about their experiences. Areas of concern include the way crisis intervention is managed, physical health checks, and the stigma faced by people with personality disorders and complex emotional needs. People also told us about the difficulties they had faced trying to access services, with waiting times, continuity of staff, and the consistency of appointments cited as common frustrations. On the basis of the feedback we received, Healthwatch Norfolk has outlined a number of recommendations for the group's next steps. These are: ensure that adults with serious mental illness have reliable and consistent support. Ensure that adults with serious mental illness have regular ongoing support to minimise the need for crisis intervention. Make sure the valuable voice of people with lived experience is not lost. Keep the mental health roles in primary care. And finalise the strategy for a strong working partnership with the voluntary, community and social enterprise sector in supporting people with serious mental illness. In the meantime, you can read the full report at healthwatchnorfolk.co.uk/reports.